Past CDC-funded research in North Carolina showed that school-based teen dating violence prevention programming can result in significant and sustained reductions in physical and sexual teen dating violence. This program is currently being widely disseminated around the country. The challenge is we don't know what works to prevent teen dating violence in high-risk urban communities. So we have designed the Dating Matters program for youth in high-risk urban communities to promote healthy, nonviolent relationships. This initiative includes school-based strategies aimed at building youth skills that support healthy relationships, programs to enhance parenting skills and communication, training to enable teachers to recognize and respond to the risk factors for dating violence. In addition, it includes tools for working with organizations and neighborhoods to keep youth safe. We are conducting a rigorous cross-site evaluation comparing Dating Matters approach to standard school-based practice, which is a Safe Dates program that's implemented in 8th grade. And over 5 years, the programming will be delivered to tens of thousands of youth, parents, educators, and community members. The lessons learned will guide future teen dating violence prevention work in high-risk communities. Next slide. We know that surveillance data is critical for guiding prevention and monitoring the results of our initiatives. The CDC's School-Associated Violent Death Surveillance System, or SAVD, is a partnership with the Departments of Education and Justice, and we have members of those departments here, Tom Foyt and Paul Kessner, and we have collaborated with both agencies on SAVD and multiple other projects over the years. The information collected each year from media databases, police, and school officials about all school-associated violent deaths in public and private, elementary, middle, and senior high schools throughout the U.S. provides us with a baseline for creating prevention initiatives. The SAVD data shows that between 14 and 34 school-age children are victims of homicide on school grounds or on their way to and from school each and every year. We knew that most school-associated violent deaths occurred during transition times, immediately before and after the school day and during lunch. And we know also that homicide, which is the leading cause of death among youth aged 5 to 18, but data from this study indicates that between 1 and 2% of these deaths happen on school grounds or on the way to or from school. We summarize the SAV deaths each year in the Department of Education's Indicators of School Crime and Safety document. Next slide. Finally, I'm going to talk a little bit more about the National Violent Death Reporting System. Although we have had extensive data on violent deaths, the information from various sources has not been integrated. Since 2003, NVDRS has linked data from death certificates, coroner medical examiner reports, law enforcement reports, and laboratory reports at an incident level. It gives us a comprehensive picture of each incident. For all violent deaths in participating states, which are the states in purple, we have gathered this information. NVDRS also provides more complete information on local deaths that includes circumstances that contributed to a violent death, the relationship of the victim to the suspect, and it links deaths within an incident to examine multiple victim homicides and homicides followed by suicide. NVDRS also provides comprehensive data and functionality that no other system offers in a fast, efficient manner that can be used to inform decision-making on violence prevention strategies at the state and local level. The states that have NVDRS implemented are actively using the data to inform their violence prevention activities. For example, former New Jersey Governor John Corzine's office used NVDRS data to help standardize how gang-related activity was defined and measured. This was used as part of the governor's anti-crime strategy to plan interventions to reduce gang violence, such as providing alternative programs for youth, to reduce gang membership, and help convicts adjust as they leave prison. Recently, in the plan that was issued by the President, the plan to protect our children and our communities by reducing gun violence, there was a call for expansion of NVDRS to all 50 states to help inform future research and prevention strategies. And this goal is consistent with the HP2020 objectives that we are taking steps to prepare for. Next slide. So we have multiple resources at NCIPC for preventing violence across the lifespan, and these are all accessible through our website. But in conclusion, I'd like to say that the Injury Center is committed to preventing violence across the lifespan, including child maltreatment, youth violence, intimate partner violence, sexual violence, elder maltreatment, and suicide. I've shared just a few of the activities of the work being done to reduce violence against children and youth and to reach our HP 2020 objectives. These activities can have lifelong benefits for children by reducing burden from violence, and by changing their trajectory for subsequent violence and related health consequences. And again, please check our website for more details about these and other activities. Thank you.